Assalamu alaikum, good evening, and welcome to another episode of Health is Wealth. I am your host, Shabnam Riaz. Well, today we've picked out a really interesting subject, and the subject today that we're going to talk about is aging. And this is something that will, if it's not affecting now, it is something that you know is going to happen. What are the implications behind it? What can we do to prepare ourselves to age? It's a natural process. How can we help ourselves on a physical level and a psychological level as well? Because it's all about empowering oneself with an attitude to be able to adapt to change. That is one of the successful ways a person can live their lives. So to talk about today's subject, which is, as I said, very interesting, we have with us Dr. Sheher Bano, who's a dermatologist, aesthetician, okay. It's a bit of a mouthful. A CEO of iPal Skin Clinic. Thank you, Dr. Sheher Bano, for joining us here today.
Shabnam. It's always been a pleasure for me to attend the show and giving free of cost knowledge to everybody.
Thank you. It's something that we really enjoy as well. And next to Dr. Sheher Bano, we have Sobia Khatib, who's a clinical psychologist. Thank you very much, Sobia, for joining us again today in the program.
Thank you so much. Thank you. And it's a very interesting topic.
Exactly.
Hot topic of the day.
Yeah, that's true, that's true. So this is why we came up with this topic, anti-aging. Dr. Sheher Bano, I'll start with you. We all have to age. What actually are the, what actually do we think is going to happen? What are our misconceptions? And also something you told me that was very interesting. When we talk about appearances and we talk about the aging process and our skin, when exactly does that all start?
Yes, very interesting, because when people walk in our clinic and when we tell them that you are actually in the aging process, oh my God, I'm not that old. How is it possible? I'm just 30. How can I be old? So this is a misconcept that I want to tell you, that aging actually starts, or the collagen degeneration starts from the age of 20 and 25.
I mean, Isn't that something that people are going to listen to, and they're going to be a bit shocked?
Because it is
because
true.
At 20 and 25, you actually think you're really
You're really young.
Yeah.
But it's the age when actually the collagen is degenerating. It's the age when you are under the depression, when you're fibrosing, the quality, the collagen 1, which is actually giving a lifting up to your skin and a little bit lumping appearance on the skin, it fades away, it goes off. So what we tell patients, that it is not only the aging of your skin, it is aging of your cartilage, it is aging of your bones, it is aging of your memory. It is aging
at 20, 25.
It does happen. It does happen. So, you have to look at all these factors. For us, usually patients come for the clinical help to maintain the anti-aging procedures, to lift up the skin, hair and nail. So this is what we tackle. And regarding the aging signs of other body parts, aging, knowing aging, that it starts from 20, you have to give the boosters through the diet, through the good quality of life, through the multivitamins, and through the good sleep. So these are general factors that lead you towards a better life, late aging, and you can prevent yourself from the premature aging. I'm more glad to tell you that what are the anti-aging foods. I just put 3 foods in my list, that is pomegranate, the oats, and the grapes.
Okay.
Wonderful 3 foods that can give you a collagen booster.
Is this because of antioxidants?
Yes, it has an antioxidant role, and it boosts up the collagen, boosts up your elastin properties of the skin. And I always, Shabnam, draw a circle that this is your aging, and what are the factors which are basically enhancing the aging process. This is stress, the autoimmune diseases, which include the diabetes, the hypertension, it is the pollution, it is the sun damage, and very important, it is your quality of life. And whenever we go out in the sun, people actually take if somebody's wearing the sunglasses, so they take it as a fashion icon. But it's very important to wear the sunglasses, because when you frown and you make faces, and you are exactly giving the wrinkles on the forehead, and they become permanent. Exactly. So you can see this on the young faces as well, that these wrinkles are actually becoming permanent. So then that's the age that you have to look at the habits, your smiling, your expressions, each and everything counts.
Right.
So this is the beauty that through the general steps, through the general cautions, you can prevent yourself from the premature aging.
Right. Yeah, that's really, really interesting because, you know,
yeah.
thinking that at 20 and 25, the aging process is already starting. So it's a bit of a wake-up call for, you know,
For everyone.
The best thing, yeah, for everyone. And the
Yeah.
best thing is to be prepared. So, Sophie, I'm going to come to you. Why are we so apprehensive about aging? And why is, you know, if you ask somebody's age, why do they get defensive? Especially, you know, the
Especially
thing is that women will
Especially
always, you know,
women, not men.
Always hide the age.
Yeah,
exactly.
why?
This is actually it's depend on the personalities also, because number of people, as doctors say, that it's started from the 25, aging process is going on, degeneration of everything is going on. A person, how he is feeling about himself or how he's perceiving about the skin and mind. A very advanced field which is emerging nowadays, that is psychodermatology, where the combination of dermatologist and the psychologist helping out the patient, how he will treat, how will he, make his mind toward the aging perspectives. Like females, we see that, as she said, that depression is the cause. Usually the person who is not looking good, or she or he don't have the body image, good body image, or distorted body image, it can be caused lack of the childhood, we can say nurturing during childhood.
Self-esteem issues.
Exactly, self-esteem issue leads toward the disorder like depression, anxiety, and other things. And the very important thing related to it, that the psychosocial aspects, how people are perceiving you, how people are looking toward you. Because when we get older, people don't get attention toward you. Usually female said that it's not my time. Our mothers usually say that it's not my time, it's your time. Because they feel that people are not going to see them, to look at them, and will not give importance to them. This is the point where they feel they are not going to pay attention toward them. And this leads them to the isolative environment, and the number of more diseases toward it.
So they're sort of feeling that they're not a valuable part of society anymore.
Exactly. When they grown up, when they cross, usually she said that 25 is a degeneration of skins or issues, but mostly people perceive that after 30, females are gonna be losing their charming status of from the society they always give. So the important thing here is how mind perceives and how female is perceiving about himself or herself.
Okay, very interesting. Dr. Shaibanu, I'll come to you now. And, of course, it's human nature to want to look youthful, to want to be rejuvenated and, everything, and have a glow to your skin and whatnot. Okay, now, where do you draw the line? I mean, it's a natural process. And then you see all these, sort of instances where famous celebrities have had some sort of surgery or whatever, or drastic, things, and it's just not matching. And you can see that something, because what is natural is natural. How much can you fight it? And how do you sort of counsel your patients who want to come in for really drastic changes?
I never say that don't beautify yourself. I always say maintain yourself. Look good. When you look good, appealingly, you will definitely have a good day. Honestly, for me, if I do not look good,
Agreed.
I don't feel energetic
I think that's
myself.
the majority of people.
And that's your
Exactly.
right.
Yeah.
For not only for females, for men as well.
Oh yes, definitely.
Look contoured in your body, have your beautiful skin, and age gracefully. This is what
Age
I mean.
gracefully, exactly.
Age gracefully. If you're having wrinkles, there's no harm to treat those wrinkles. If you're losing the fat compartment in your face, this means you are the candidate for the fillers. Get the artificial fat compartment. I won't say that overfill yourself. This is one of the worst things that you are doing to yourself.
Exactly.
So many people, by looking at the media and bringing the pictures of that artist to us and say, please doctor, give us this look. So this is not possible for us. You have your own look. You have your own bony structures. For me, I have to decide to give you anything which is according to your body contour and the face contour.
And which will work with your
Yes.
sort of natural...
So we will try to tackle it very naturally to age gracefully. Nobody wants wrinkle on the face. Nobody wants the hanging folds and the cheeks, right? So there are general procedures with which we can always help them and guide them, which are safer. And my agenda, my point of view is always, always that less is more. When you're giving less, it's definitely beneficial for the patient. You're giving less filler, good for them. You're giving less threads, good for them. You can add on more afterwards. Different ages have different categories. If you fall in the age of 20, apply the narrow band sunbox, the broad spectrum, which contains the UVB factor, the UVA control factor. The SPF is a sun protection factor. For every skin, sun protection factor 35 to 50 is well enough, is good enough. Must wear it daily.
Right.
Number two, there are certain kind of creams available in the market with a composition of hyaluronic acid, the retinoids, and the peptides. These three containing creams are amazing for the anti-aging to prevent the premature wrinkle. But remember, once you are having the wrinkle on the face, then there is no premature or prevention for that, then there's a treatment for that.
Okay.
Because there are three layers of the skin. One is the superficial, one is the deeper layer. And there's a very strong junction between these two layers. The cream particle size is not that small to penetrate that junction. So you need an invasive treatment for that. So that's a misconcept. The doctor is putting us to this much treatment and that's a budget problem for us. There must be an indication for that.
Right.
Right?
Okay.
So that if you want to discuss in your program,
We will.
I can even list those treatments,
We will.
what is good for what age.
Right. We're just going to go for a break right now, but stay tuned. Don't change the channel. Okay, welcome back to the program. Now, Sobia, let's come back to you, and we'll talk about, you know, the sort of issues that a person has. What about people who are obsessed with the aging process?
The people who are obsessed related to their appearance, appearance of how they are looking and how others are perceiving. Basically, it's depend on the personality, that what kind of personality they have. It's related to the borderline personality. Most of the people, those people who have the childhood bad experience, those people who don't have, you know, the safe family interaction, are those people who don't have the social interaction toward the, you know, friends and families. They emerge with the obsessive compulsive disorder with the skin issues. Like we see the number of people are always, you know, complaining about the pimples, freckles or anything. Young girls related to the main event, that they just start to perceive about that on my special day maybe the pimple will appear on my face. On the main day, on the special day, the pimple is on her face. Because of the thought processes, she perceived that thing, she think that this will happen to me, and on that day it appears on her face.
So she gets the breakout because of the stress?
Exactly, stress and the whole connection she made in her mind.
The mind is that powerful.
Exactly,
Right.
because the body is interacting to the mind, and mind is, you know, responds back to the body. How will respond, how will react, because we have the noding system. It's always called a psycho-neuro-immune system.
Okay.
Yeah,
Right?
there's a proper mechanism.
Proper,
behind it.
exactly. It's
Okay.
when how thinking process is and how
So you can think yourself to a good skin?
exactly.
Wow.
When you think that you look good,
Yeah.
you feel good.
So it's true about the positive energy thing, that positivity
Exactly.
attracts positivity.
Yeah,
This supports
it's
that
a
theory
different
too.
thing. The positive thinking about your appearance, how you are perceiving, what's your experience about your skin.
So, you know, what you're basically saying is that when you look into the mirror or you look at pictures of yourself, you should have a positive feedback to that, and you should tell yourself that, you know, okay,
You
this
look
is
better,
me,
you look good.
this is how I am, and
Yeah.
I like myself
Exactly.
how I am.
Basically,
Okay, there are things we can change. That's, of course, that's natural.
If this everything makes up their mind, then there won't be any difficulty for anybody.
Yeah, and that all falls
And
into the
those-
liking yourself
exactly.
category,
Those
doesn't
people
it?
who having the stress disorders are stressing a situation, they always have a low immune system. And the number
Okay.
of infections, you know, appears on their skin, and they always, you know, go to the doctor, and sometimes doctors is not advising him or her. It's just because of the stress. But in our society, we should, you know, educate our people that it's related to your mind too. This can be happen because you are overthinking on your skin, and our media is working very, you know, greatly to good appearance and look good and everything. Usually, youngsters are very much, you know, obsessed about their appearance, and they used to go to the dermatologists, salons, parlors for their appearance.
So I want to add on something that initially when this aesthetic field started, it was just a want. It was not a need. Now it's a need.
The supply and demand
Yes, it's a
sort of
need.
scenario,
It's a
isn't
need.
it? Yeah.
You know, can you see all the cycle? Due to your looks, you are in your you are exactly in the stress. The stress is releasing more catecholamine hormones.
Exactly.
The catecholamine is instead giving you acne, the hyperactive melanocyte, which is a melasma or chaya, hair fall, collagen degeneration.
Nizim.
Due to stress, you are taking a lot of smoking, usually men, so you are processing towards the aging. So this is all a circle. This is a vicious circle that is created by us. So there's, I mean,
So we're being self-destructive.
we've been self-destructive, Shabnam.
We don't
There
have
are too many things. Either be happy what you have,
Yeah.
or if you are not happy what you have,
What is achievable? Achieve
what is
that.
achievable, achieve that. This is the point. And the ways are quite simple. Yes, we come across a lot of questions. Doctor, we are not affordable. Doctor, can you help us? These treatments are very expensive. Truly, they are expensive. That's why we always tell them, make your skincare kit. A skincare kit which starts from around age of 20.
Okay.
That contains sun protection.
Uh-huh.
That contains the alpha hydroxy acid face washes.
Okay.
That contains a good hyaluronic acid based cream. Or if even you can't afford that, at least you can take those fruits which help in anti-aging process.
And
The one I
those-
mentioned.
The three that you
The
mentioned.
citric acids, the pomegranate, the avocados, the oats. These are the simple ways you can walk half an hour, you can take a good sleep, and you can wake up early in the mornings and enjoy the life.
Right.
Make your quality of life better. So these are few simple steps that if we are telling, this means that you have to follow. And trust me, Shabnam,
That makes
you
a
can make
difference.
your life better by these
Exactly,
simple
just
means.
by being positive.
Just by being
So,
positive.
Dr. Shabana, tell me this
Sure.
dilemma. I've seen this happening.
Okay.
Many people, I mean, especially I'll talk about girls,
Yeah.
definitely, and young girls, they, because the selfie
Fever.
the selfie fever, the selfie
selfie disorder diagnosed now, right
yeah,
now,
it's been
exactly.
diagnosed, I think, as
As a disorder.
As a disorder. Okay.
Exactly.
Oh.
So selfie-itis, let's talk about that. We have this constant, scenario where your phone is in your hand, and then you have social media like, Facebook and Snapchat and Instagram and
Yeah.
whatnot.
Yeah.
So for that, girls are becoming obsessive because you see them taking pictures and they're just not happy with what
They're
is
always
happening.
trying to be filtered themselves.
And then they're filtering their pictures, and then so what actually goes on to whatever feed they're posting on is an altered image of them as they would want them to be. And so then, of course, when you have this dual sort of a personality, I've seen people who have been isolated and not really going out that much in public because they have a different persona which they've created from their
Honestly,
cameras.
we are actually ruining ourselves. This is not the good way to achieve the good looks. We try to change our features. We try to give a V shape. We
Not
keep on
every face
changing.
is camera friendly.
Yes, we keep on changing the
Sides
portfolios. That the face should look a little bit slimmer. We keep on changing the angles through the selfies, and we post it.
Yeah.
So this is the interaction between different people. It was not few years back, but now it is. Showing them the beautiful side of themselves. You are definitely beautiful. This is the point that, you know, again, she's saying that it is a psychodermatology. I mean, every female has got a beautiful look. This is we call it a V lift because the perfect face that we can give to the patient is V. So everybody wants to have that V shape. So if you are actually obsessed and you want to change the feature, go through certain procedures which can exactly give you the beautification what you are desiring for. Or either accept yourself, keep your life simple and beautiful. I don't like these posings, honestly. I never favor these posings.
Right. Because it does come from within.
Yeah.
Exactly what we're discussing here is that, of course, you know, it's natural. The reason you use cosmetics, the reason you care for yourself, you know, you get a haircut or whatever, is to make yourself feel better about what you've been given, and there's no harm in doing that.
There's no harm in
To
doing
groom
that.
yourself, it's a good thing.
To look after your appearance and to enhance the things that you've been given.
Perfect.
We don't have a problem with that at all. The thing is to develop that positive attitude and then work on that. So what do you advise your patients, Sobia?
Basically, I used to advise related to the skin issues and any psychological disorders, CBT, cognitive processing therapy. It's a basically whole chunk of, you know, different discipline included in it, where I just change the perception of person. If someone likes any model, like she said, someone's, you know, dragged any kind of picture and said, please make myself like this. And what he is in actually, we are, you know, processing step by step, tell her that this is your actual picture, what can be done or what can be, you know, in the future good points is like, you can groom yourself like this, you can have haircut, you could look in this scarf system or anything. What adjusts you, not make, because the problem is only we are always perceiving what others are, you know, looking for us. We are not perceiving but how we are managing or how we are looking, good or bad. We always have the point in our mind that other will, you know, encourage us, praise us. We always trying to. So in that procedure, we are trying to connect that lady or a man or a young girl to that step by step false perception about her beauty. Sometimes it's happened in many cases that they perceive that they are the Angelina or they are whatever they are perceiving.
I think, you know, one of the basic things here that we're talking about is self-confidence as well.
Self-confidence.
Because I think that this self-confidence is so attractive. A person who believes that they look good, they sort of
They feel good.
radiate
Yes.
Exactly.
that
Radiate the
feeling
positive
around.
energy.
And
True.
the same way, somebody who may be physically or aesthetically naturally more beautiful, but who lacks that confidence, may not seem as attractive as the other person. So that makes such a huge difference as well. So, Dr. Shahbana, tell me something. Lots of people, we're more inclined to say you have a specific budget,
Okay.
and you would say a patient who comes to see you, and they have other health issues as well, which are because of aging. Is there more of an inclination now to fix ourselves aesthetically rather than from inside what's going on there?
They have to focus on both. Definitely, it is my job to fix them aesthetically, but then it's the job of another doctor who is going to see the aging of their bones, their body, the degenerative changes of the collagen or the cartilage. So on my point, Shabnam, usually I start from the basic techniques, which I always tell patient to start from the basic, and then if you have an indication for aggressive treatment, go for that. The basic technique is just to do a PRP treatment, which is quite famous in these days. If you're reaching at the age of 30 and you're actually taking the preventive treatment, that is a sunblock and a good night cream, it is better to give a booster to the skin, the booster of the collagen, which is a platelet-rich plasma therapy. Now, what is that? You must be discussing in a lot of your programs, which is an autologous stem cell transplant. So that's the same technique. With your own blood, we make the serums, Now what we are making the fillers out of it. So that's the beauty of your own blood. This procedure, we call it a vampire facelift because we are actually treating your skin with your own blood. So you are drinking your own blood.
Okay.
So we are
artificial,
lifting, yes, no artificial,
things going in.
no additive factors.
Okay.
Yes, it's just a collagen booster. Another fact, there are IV collagen boosters that people prefer. There are antioxidant drinks which people prefer. There are collagen drinks now in the market.
Exactly.
So always give an external booster collagen, which is very mandatory.
So these drinks, these are, how effective are they?
These are quite effective if you have to start from the early age. So these are quite effective.
Oh, they will only be effective if you start at an early age?
It is a prevention.
Okay.
Again, if
right.
your skin is damaged, if it has got a wrinkle, it is hanging, it is losing the fat compartment, this means you are the candidate for the treatment, not the prevention.
Okay, so
But
that's prevention.
this extrinsic collagen you have to take side by side all your life. It is
Okay.
like any multivitamin.
Oh, right.
Exactly.
Do you believe in multivitamins? Because the diet nowadays is not healthy. We do not take meat, maybe we do not like that green vegetable, maybe we do not take
So
an ample amount
what are
of
the foods
fruits.
for good skin? What should we be eating? You've mentioned 3
I
for
have,
the aging, anti-aging process, but
Every fruit, every vegetable has got its own characteristic. I must say, take a balanced diet which has got composition of everything. If you're unable to take the balanced diet, at least add on some multivitamins, at least add on some zinc, at least add on some biotin.
okay.
So these multivitamin complexant is a complex of essential vitamins that we have to take extrinsic surface. We do not make it intrinsically inside the body.
From our diet, when
Yes.
if we're lacking that in our diet,
You
then
know
we
the
should-
important fact, we got hyaluronic acid in our body. The HA fillers we talk about, we have that in body.
Everything
With the
is-
passage of time, this HA or hyaluronic acid degenerates. That is why the skin looks very dehydrated,
Yeah, okay.
very wrinkly, that you need to do a pressing kind of treatments like a thermi or RF. And the good thing about that skin that it can be reversed back.
Okay. Okay. Now I have a very interesting question for you. Why is it that some people just do not look their age, and some people, unfortunately, look older than they actually are?
True.
Is this a genetic thing that we get? And
Truly
Tell us about that.
genetic, and now people are looking forward to maintain their body and skin. You have no idea, like so many women at the age of 60, they look younger than me. Because
no, I find that hard to believe.
But that's true. That's true. I mean, I'm a witness for that. Because what's happening, they are actually trying to maintain the body. They are doing the yogas. They are doing exercises. They don't want to age up.
Yeah.
They don't want
Exactly.
to age. And whenever you ask the
Yeah.
question, what do you do? I don't do anything. This is genetic.
It's natural.
So
usually they say it's
natural. It's a
Exactly.
quite common question that we
Right.
come across. But trust me, they have been doing so many things.
Uh-huh.
If there's a loss of volume in the face, they are taking the filler.
Okay.
If there is a wrinkle on the face, they are taking Botox. If they needed resurfacing, we are providing them the resurfacing lasers. We are giving them the boosters in the form of the PRP. Now, luckily, aesthetic has developed too much, and everybody's doing that. That we can give a very safe, very gentle, very cheap treatment just to get a booster for your skin. So why to wait?
Why to wait? Exactly.
Yes.
So
I would
you
like
tell
to
us-
give answer to you
Yeah.
because this also is because of the personality. I always mention personality. You people are saying that why is personality?
No, we
Because
agree with you.
they are the very relaxing people, very relaxing people. Usually the calm personality and very calming, charming people usually look slim, young, youthful, and when we ask them what you are doing with your for lifestyle or give us any tip, they usually say that relax yourself.
Yeah. Okay.
This is the very primary tip to give to the everyone, that you have to relax yourself if you want to be look yourself as a youthful person.
So she's trying to relax, and I'm trying to give the treatment. So
Exactly.
it is a good combination, and you are telling people that what exactly to follow.
Exactly.
Yeah, there's a
exactly.
good combination, and I think
Perfect.
So how does yoga help, Dr. Shaban?
Exactly.
mentioned
Meditation
yoga.
helps a lot for your skin. We usually suggest or recommend people a PMR, progressive muscle therapy. It's a
that sounds
therapy.
good.
Yeah, a progressive muscle therapy. It's a kind of therapy designed for those people who are anxious, who are having a psychological or psychiatric disorders with them. This therapy helps them to, relax their mind and body, connect their body and mind, and step by step, suggest them that how you will relax and how we will. It's a basically process of deep breathing process. Deep breathing process. We usually take not a breathing. Our breathing process is not good. We usually not taking deep breath. So in that procedure, a progressive muscle therapy, we suggest the patient that if you want to relax yourself, it's with the meditation, medication. It's a combination of whole procedure. We suggest the people and clients to relax yourself. When it gonna relax, then the cognitive processes, understanding power, and the perception of new things and energetic things can be happening in his life.
It's basically about slowing down as well,
Slowing
isn't it?
down,
Because we're all at
exactly.
such a fast pace that we're probably sitting
Because
here.
the thoughts are rushing up
We're
in his
probably
mind.
sitting here, but while we're sitting here, we're still thinking of all those things that we've got to do. Because when this is over, I've got to do this, and you're probably thinking, I've got
How
to
can
do
you
this.
read my mind?
And so that's what we're doing. We're consistently on overload
Exactly.
and multitasking.
Overloaded. Every
Yeah.
time overloaded with the thoughts, every
Yeah.
time thinking, responsibilities.
And
So that
usually-
really our focus as well, doesn't it?
Shabnam, we have a lot of responsibilities. We can't say no to them. We have to tackle with everything. Previously, the women were not working. Now, every woman you see is working equivalent to that of man. They're working in their homes.
While
they're working
still carrying on those responsibilities
in their
that she was doing before.
stations. Yes, they
Yeah.
are working with the kids, their children, whether they are grown up or they are young. So it's all
Pressure
the
has-
responsibilities. You have more pressure now.
Right. Dr. Shabana, tell us this. You were talking about skincare basics.
Yes.
So now, if you talk about each age group, specific
Yes,
to their
perfect.
needs, what should they be so that our viewers can be a bit
As I
clear on
mentioned
that?
you that at the age of even 20 and before that, the sun protection or the SPF factor 40 or 20, everyone should
40
wear.
or 20.
Yes.
Okay, right.
Give antioxidants at night. Do not wear the antioxidants in the daytime. There are usually combination of creams which are giving you the vitamin C along with the SPF, which is not a recommended at all, recommendation from my side at least, because it can give you the skin burns.
Okay.
So whenever you are using the ascorbic acids or vitamin C, never forget to wear the sun protection. So it is the age group before 20 or even at age of 20.
Okay.
Sunblocks. Sunblocks are even made for the younger group.
Okay.
SPF 15 is more than enough. It's
Right.
available in the spray forms. When you reach at age of 20 and between 30, then go for the natural treatment. What is that? The collagen drinks, the sun protections, the hyaluronic acid based cream, and one treatment that is PRP. If you do not forget to clean your skin at night. Cleansing is one of the best thing that you can do for yourself.
Is it true that if you go to bed with your makeup, you are committing a huge cardinal sin? Is that right?
Yes,
Yeah.
it's absolutely right. I can read it from your face that you are quite frequently doing it.
Exactly.
So, the best thing you can do to yourself: do not use face washes. Do not do anything. Clean your skin at night.
Okay, just a cleanser,
Just
a regular
good cleanser.
and just
AHA, alpha hydroxy acid based cleansers at night is more than enough.
okay,
Easily available in the market.
right.
Cleanse your face at night. Let your skin breathe. And put an antioxidant on the face to remove the free radicals which have been damaging the skin
Right.
through the pollutants and the sun damage all the day long. And when you are taking the collagen drinks and PRP, I think you won't age that progressively. It will
Okay.
take a lot of time.
So it's all about being intelligent and having an intelligent attitude
It is a
towards
skincare. Side by side,
Yeah.
on the skincare, you have to take care of the body.
Exactly.
You have to take care of the sleep, the diet, the exercise. So what it is pointing towards a good quality of life.
Your lifestyle.
A lot is
lifestyle.
required for a good lifestyle. Please, I will suggest, do not put on weight. You do
Oh,
not
yeah,
put on
that
weight.
is
This
a-
is
That's
an
a big
umbrella
reason.
which is actually giving to a lot of...
And again, the vicious cycle, because you have the fast food,
Yes.
Exactly.
and then you have the
Environment.
sedentary lifestyle, And then you have lots of jobs where you're just actually basically sitting and it's all mental exertion and not physical exertion. Then you have the stress, so the whole thing becomes an awful cycle for you.
You know, these are the things from which you cannot take yourself out.
Yeah.
You have to manage.
You have
So
to.
try to be a good manager rather than to stay away from these things. I can never stop myself from taking fast foods. I cannot stop myself from wearing the makeups, good things, eating good things, hanging out. So you have to be a good manager.
Balance.
Balance.
Good
things.
manager.
Yeah. So tell us about, you know, when you have an elderly member of the family, how should one tackle them? How should one be able to handle them with the right, you know, amount of, because they crave a lot of, you need to be very patient with them, some of them, and, you know, to give them that love and affection and make life comfortable for them. What are your tips?
Okay, in elder age, usually people don't care about their self. This is the big issue and this is the big problem. They just, you know, take caring of their family, household, everything. They're not taking care of. The person who are taking care of, like any spouse or daughter, son, they have to give them importance that you have to take care of yourself too. You are the important for us. If your skin, if your whole body would be adjusted or would be good, then the whole cycle of our whole family would be good, you know, lead toward the good thing. So first and very most important thing, that try to give them that, you know, give them importance to be take caring of themselves. They are not taking caring of themselves. Second thing, give them time, because they don't get the time to take care of them. This is the issue, because there are as we are discussing that number of pressures for ladies. They are doing dual duties, take caring of their child, doing you know, jobs and everything. Give them time, because I always suggest to my patient, take half an hour for yourself only, where you can think only for yourself, because we just forget ourselves, and we are, you know, tackled in different kind of disorder, diseases, as we usually see men and women having diabetic problem, BP issue, everything, because they don't have the proper lifestyles later on. They are jungled up into different duties and responsibilities. So just try to make sure for yourself that take in 1 hour for yourself in a 24-hour where you can take care of yourself.
And in fact, I would say that, you know, not just for the elderly, that would be something that
For
everyone should be doing.
everyone.
You should have that alone time, quality time with
Quality
yourself.
time for yourself.
Because honestly, I think that we don't do that.
We don't do that.
One thing I've seen a big difference in women who are sort of living in other countries in the West and the usual Eastern women is that we tend to not give ourselves a priority. Maybe things are changing now. If they are, that's good. But over there, I've seen that, you know, women are very assertive. They're very proactive. They know that if they are healthy, physically and emotionally and mentally, they will be able to bring up a much better family and children and be able to, you know, provide a good environment for the kids as well. What do you say, Dr. Shehbanu? Are we as women living in our part of the world, are we giving ourselves enough priority? Are we taking care of ourselves?
I think we expect from someone else to take care of us.
Exactly.
Our husbands. So we are reluctant, we are dependent on them, and we show them the mood swings, that I work all the day and you are not taking care of me, oh my God.
Right. Yeah.
So this is what is happening.
Yeah. Whereas they're also working and they're
also working, they're also stressed out.
Yeah.
And vice versa, we are working, we are stressed out.
Exactly.
So this is what we have to think and take care of, that you be part of him and he be part of you. So try to work in, what do you say?
Tandem with each other.
Tandem with each other, exactly.
Right.
In a pace, built up a pace with each other.
Yeah.
And life will be so simple. Give time to each other.
True.
Because time
is one of the most valuable commodities,
even if you are giving enough time on the weekends, that's sufficient, Shabnam. For this world, like, which is running, the time is running like anything. It's better to give some time. Stay alone. The kids should play, or either they're sleeping. Sit together, sit on a table, have dinner together, talk to each other, discuss each other's activity at the end of the day.
And instead of talking about the problems, that you're facing every day, that every husband and wife will, you know, sort of when you catch up, like, this happened, this happened, this happened. Put everything aside and have a little time where you can just talk about something.
Good things.
Start with the problems and then
blessings.
you can discuss
Exactly.
something else.
Yeah.
Because if you have those problems in the mind, you can't ease yourself.
True.
Exactly.
That's
Usually we are
So-
always discussing about the problems, not blessings. So start count from the blessings.
Another
True.
attitude shift, I would
Very
agree
well
there.
said, well
Yeah.
said.
Okay, let's talk about our part of the world climate-wise. How can we help ourselves to, you know, to protect ourselves from damage?
You're asking a little bit difficult questions.
Uh-huh.
Okay. As we are losing a lot of ozone layer,
Yeah.
so the planet Earth, the individuals living on that Earth are in the danger. We are having a lot of skin damages because of the sun. The sun burns. Luckily, we have so much pigmentation or melanocytes in our skin, the Asians, that it protects us from the sun damage. For those who are living in the West and those who have very fair skin, they are more prone to the skin damage. Why? Because they have less number of melanocytes to absorb that sunlight, and it leads to the skin cancers. You can see a lot of number of cases who are leading to the skin cancers, which is known with the name of basal cell carcinoma or squamous cell carcinoma, and these are actually the skin cancer which is more prone to these fair skin individuals because of we are having a lot of dangerous sun rays on Earth which is damaging the skin.
Right. Okay, so right now we're going to show you a report. Let's have a look at that.
This video will help you understand why your skin ages, what you can do to slow down the process, and how to reduce the signs of aging you may already have. One of the primary reasons we age so differently is due to genetic factors. Just as genes from our parents determine our hair and eye colour, they also determine how we age. Your genes control several natural processes that cause your skin to age. Let us take a closer look at some of these different factors. Your skin is constantly renewing itself by shedding the old and damaged outer cells of the epidermis and replacing them with newer cells. This process keeps our skin looking fresh and revitalized. The lower layer of skin, or dermis, contains collagen and elastin fibers that also provides the skin with structure, support and elasticity. Beginning in your mid-20s, the skin cell renewal process slows down and your skin becomes thinner and more prone to damage from external elements like the sun, harsh weather and pollution, producing a dull, rough or uneven texture to the skin. In addition, the collagen and elastin fibers within the dermis begin to break down and diminish, so fine lines and wrinkles appear and the skin starts to sag. Lastly, the lipids, or natural fat, that protect the skin's surface against water loss, break down in response to changing hormone levels. The skin's natural moisture barrier therefore becomes leaky and allows water to escape, which is why your skin may become drier with age. Environmental factors can accelerate the normal aging process. Repeated long-term sun exposure is the primary cause of premature aging. Ultraviolet light from the sun causes melanocytes to produce too much pigment or colour, which results in the formation of freckles and age spots. Damage from sunlight also accelerates the breakdown of collagen and elastin in the dermis. This is why people who spend a significant amount of time outdoors without proper protection usually experience deeper lines and wrinkles and greater skin laxity. Mechanical factors also contribute to skin aging and include gravity and repetitive muscle movements. This is why people who have very expressive faces tend to have more lines around their eyes, mouth and on their forehead. If you have maintained a good skincare routine and avoided substantial sun exposure, your skin should look and feel beautiful in your 20s and your 30s. Using a daily moisturizer with sunscreen and continuing to exfoliate will help keep your skin looking radiant. Signs of aging become increasingly apparent in your 40s and 50s. Although your skin can still look healthy and vibrant, the effects of long-term sun exposure, repetitive facial expressions and the normal aging process start to accumulate. The fine lines around your eyes deepen and forehead lines and glabellar lines may begin to appear. Age spots and other pigmentation irregularities generally start to appear in sun-exposed areas. If you would like to reduce the appearance of facial lines and wrinkles, non-surgical treatments like hyaluronic acid fillers may work well for you. Before you decide on any medical treatment, consult your medical aesthetic practitioner for the best advice that is appropriate.
Okay, so hopefully you found that informative, that report as well. And, you know, I'd like to thank my guests, Dr. Sherbano and Sobia, for being here with us today.
Thank you so
and
much.
And for talking about something that I think is a concern for everybody, and it's been so informative. You know, to think of the mind, body and soul. Everything is occurring together in complement. And we have to, if, you know, we're going to have a healthy lifestyle, we have to know how to manage all of these things.
All of these things.
So,
exactly.
you know, it's been really, really wonderful to have you guys on the program.
Thank
and
you so
giving
much,
us all
Shabnam.
this
Same here.
information.
It's our pleasure. And
Right.
honestly, that this is very, very informative topic that you are discussing on the screens and telling people about that how to prevent aging.
Yeah.
So that's the beauty of your program.
This is the
Thank you so
actual, you know, medium of using your awareness sessions and all these.
Exactly,
This is
exactly.
the
We're so happy to be able to provide that information and also for your valuable input as well. Okay, so we come to the end of today's program. I'm sure this is something that, you know, everyone will be able to benefit from. It has a huge interest for everyone as well. So until next week, stay happy, stay healthy. Bye-bye.